off 1 millimeter, the patient could be paralyzed.
Imagine needing metal screws implanted in your back to relieve excruciating pain. On segment 2 tonight, Bob McKenzie takes you into the operating room for an astounding procedure.
And now, the award-winning 10 o'clock news on Channel 2, the #1 primetime newscast in the country.
Prone to wearing, that's where the spine gets into trouble.
Plus, segment 2 explores one dramatic way of easing a chronic pain that plagues millions of Americans. 10 o'clock news continues in less than 2 minutes.
She couldn't lie down, stand up, or sit without pain.
Sometimes I wanted to scream, and I have. I've just sat up in my bedroom and nobody home, and I've just screamed.
I'm Bob McKenzie, the surgery of last resort. Still ahead tonight on segment 2.
Still ahead tonight on the 10 o'clock news.
So far, so good. How about you, kid? What kind of a morning have you had?
Bob McKenzie introduces you to a Bay Area woman and the marathon medical effort to help her ease her pain. Millions of Americans suffer from chronic back pain. Often exercise can provide some relief, but in some cases the non-stop pain can dominate virtually every moment of their lives. On tonight's segment 2, Bob McKenzie introduces us to one Bay Area woman who faced the pain and found an answer.
Brenda Brown-Delia can tell you all about back pain. Several months ago, she was stricken with a sudden agonizing pain in her lower back and one leg. It has not let up since. It hurts most when she lies down, so she's gotten little sleep. She's up half the night, slowly prowling the apartment she shares with her husband and son, popping pain pills, alternately sitting and standing because she can't stay long in either position. When we met her in October, she was in despair.
There's a lot of people, they'll see me. I go out to the doctor, I'll be out, right? For a while I was able to drive, right? And they think, oh, well, she's not too bad. She's not too bad. But if they had to feel, at times, what I was feeling, to even drive a car, or to walk, or to have my family have to help upstairs, they don't know. I mean, I've been an active person all my life. They don't realize what even just those little movements do to me.
Several times as we were talking to her, Brenda had to stand up or sit down. The pain gave her little rest. She loves her job as a bartender and is known for her outgoing personality and wicked laugh. Since the pain came on, she hasn't been able to work or laugh much.
Sometimes I wanted to scream, and I have. I've just sat up in my bedroom and nobody home, and I've just screamed.
After half a dozen doctors told Brenda they couldn't help her, she found Kenneth Light, a San Francisco surgeon who specializes in repairing spines.
There are conditions that respond to surgery, and there are conditions that respond to conservative treatment. And it's up to the smart doctor to be able to separate those conditions out and prescribe the most appropriate treatment for that condition.
Early in October, Brenda's husband brought her to St. Francis Hospital for surgery. Spinal surgery is always risky, but the Browns felt they had no choice. Brenda couldn't go on suffering. Morning. How are you?
So far, so good.
How about you, kid? What kind of a morning have you had?
A little rough because I haven't been eating pain medication. So
about time you had some surgery.
Oh, yeah, I'm ready. I'm ready for it to be over with.
You have the regular X-ray?
Yeah. Right now.
Dr. Light and his assisting physician lay out the battle plan.
The vertebrae are these solid white squares, and the space between the vertebrae are the disc. It's made of cartilage, and that's prone to wearing. That's where the spine gets into trouble. These two bottom discs are completely worn out, and as a result of that, this L4 vertebrae has slipped forward on this L5 vertebrae, which you can see. And it's narrowing this little opening in the spine where the nerve comes out.
Once he makes the first cut into Brenda's body, Light must stay with her. In the course of this 9-hour surgery, he will take 1 2-minute break to visit the men's room. It takes him more than 3 hours simply to work his way down to the area he means to repair, cauterizing blood vessels as he goes and carefully maneuvering around nerves.
That's one thing about these operations is that there's no margin for error at all. If you're off 1 millimeter, the patient could be paralyzed.
On the one hand, spinal surgery is delicate and meticulous. On the other hand, it has aspects of blunt mechanical labor, like fixing a car. Light will use metal screws that will stay in Brenda's body.
Is it 6.5? 6.5.
The idea is to anchor the screws in 3 of Brenda's vertebrae and use the screws as handles to pull the one offending vertebra back into alignment with the others. An X-ray gives the physicians another way to check that the screws are going in the right places. Brenda is not an easy case. She's a smoker, so her bones are brittle. She had spinal surgery before, decades ago, so the anatomical landmarks aren't where they're supposed to be.
Yeah, you try to do things and to try to, make things perfect, but sometimes you can't. And so knowing when to quit it's a difficult thing because the patient came to you and is having a lot of trouble, and so you're not going to give up until you get the job done. Large cap. But sometimes if you're too exuberant, you can make it worse. So you don't want to do that.
At the end of this surgical marathon, Brenda's spine is equipped with considerable metallic gear, but the pressure is off of that nerve. A bone graft from her hip will eventually fill in around the metal.
She's going to be able to walk a little bit better. Her back's going to be sore for a while. And the bone has to grow in for that to really, that takes a few months.
3 weeks later, we drop in on Brenda. Her hip is sore and she's using a cane to walk. But she says her back and her leg feel fine.
Now the pain I have now, which is not that great, is healing pain. It's a total different type of pain. So each day that goes by, I feel better.
In Redwood City, Bob McKenzie for the 10 o'clock news.